Good morning, everyone. I'm Dr. Nantale Vanessa Nubulwa, the organizing chairperson for this year's event, and I'm here to just introduce to you this workshop about basic hemodynamic monitoring and management.
This is the first workshop on hemodynamic management that we have done for the association.
So the workshop objectives, we're really just basically going to recap the relevant physiology, understand the basic hemodynamic principles, learn key monitoring techniques, and be able to apply this knowledge in clinical scenarios. We'll also go through the monitoring techniques, the non-invasive versus the invasive techniques, looking at pros and cons, and then when to use what.
Today we have come to the end of our first day of the workshop. We started by a pre-test where we assessed our level of knowledge before the conference started. And then throughout the day, we've had different presentations from different members of faculty who were teaching us about the basics of the hemodynamic physiology, cardiovascular, how do you monitor a patient that comes in with shock, the different types of shock, how do you monitor. Then at some point, we also had a presentation from the Mindray people who taught us the different monitoring parameters and which machines do which kind of monitoring. We had 4 different clinical scenarios in 4 different groups. At the end of the day, we learned how to manage a clinical scenario in each of our groups. We are looking forward to the next days of the conference and the workshops. Thank you, AAU Organizing Committee, for this. We really appreciate it.
World Anesthesia Day!
I would like to welcome you all to day 2. This is the 10th annual conference, and this year's theme, as we all know, is improving access to anesthesia and critical care for all in Uganda, challenges and opportunities. Day 2 is going to be highlighted by 2 sub-themes, workforce training and systems and policy. Everybody welcome, and hope you enjoy the day.
Indeed an honor and my pleasure to be back home. This is the 10th AAU conference. I remember we were there for the first one. Mary and her team, thank you very much for this honor of inviting me to come and share with you. Congratulations all, and happy World Anesthesia Day.
Personally, I'm very honored. We are very honored that you agreed to come and speak to us as the keynote speaker. And so it's an honor and privilege to invite you to accept a small token of our appreciation.
Today, being the second day of the annual AAU and ICSU conference, I've learned a lot from the teachings and sharing experiences from our seniors.
Lots of keynote speakers sharing experiences, knowledge that really stood out. We had lots of sessions like using e-learning and simulation learning to share anesthesia within the country and in regions that are far to reach.
And I look forward to learning a lot and having fun.
Happy World Anesthesia Day!
It is my great pleasure to welcome you to day 3. So today we shall focus on 3 key sub-themes, that is patient safety, policy and systems, community engagement and ethics.
I would like to introduce our chief guest. It's my great honor to invite Dr. Olaro to give us our closing speech.
I'm happy definitely to join this fraternity of anesthesia because they used to feed me a lot with the anesthetic agents when I was operating. So I hope now it has changed, that the anesthesia agent don't only act on the patient but also act on the what? On the surgeon who is operating. I want to once again thank you that the ministry is ready to work with you to make this a reality, so that we just don't come to these conferences, we speak and do what? We want that we make it what? A reality. I'm going to take it personally on my side to see that we recruit what? Anesthesiologists.